I've been practicing cardiac surgery for over a decade, and in that time, there have really been rapid advancements in many aspects of cardiac surgery, but especially in the treatment of heart valve disease, in that there are many transcatheter and minimally invasive treatments that are excellent for patients. A relatively recent advancement in aortic valve treatment is the TAVR procedure, transcatheter aortic valve replacement, and this is a procedure in which, in most cases, we can go through a patient's groin and replace their valve with an incision of far less than an inch. The TAVR procedure allows patients to recover much faster than a traditional open heart surgery. In an era of very specialized medicine, where patients often have to go see multiple specialists and undergo multiple imaging studies, in many cases, this can take days, if not weeks. And this can be very challenging for patients and their families to have to undergo this type of workup. So what we have done is we've consolidated that into one day, whereby patients can come, they can see myself as the cardiac surgeon on the valve team. They can see a cardiologist who specializes in the heart valve problems, and they can also have all of their imaging studies all in one day, so they can have a prompt answer and ultimately a prompt treatment for their heart valve problem. The fact that I am an expert in both open heart surgery as well as transcatheter valve procedures really provides patients with an unbiased perspective on what's going to be the best treatment for their heart valve problem. Cardiologists can only treat with a catheter. Most heart surgeons can only treat with open heart surgery. Since I can do both, patients have a very unbiased perspective on what's going to be the best treatment for their valvular heart disease. Patients should expect to be in the hospital after a transcatheter valve surgery, in most cases for 1 to 2 nights. One of the most important things a patient can do when they're recovering from any valve procedure is to walk and move about and try to engage in progressively more normal activities. It's very important for patients to understand that whether they are going to have their valve disease treated with the transcatheter approach or with open heart surgery, that it's going to be safe. They're going to be able to live their full, normal, productive life, and that myself as their surgeon will be with them throughout the whole process.